This is a paper that is a new paper too. It's joint with Sarah right here from Washington and Lee, and Sean Wilkoff, who's at UNR. And it goes back to actually a discussion that we've had over the past day, which is aging population is causing a lot of fiscal burden. But actually, when you look in the data across the world, countries differ tremendously in how they finance retirement benefits. So you could create a bit of a spectrum from the pay-as-you-go countries all the way to the pre-funded countries. You'll see France at the top, actually originally from France, and almost entirely pay-as-you-go. Right? The US is not far behind. I mean, we look at Social Security, Medicare, it's a little bit of a trust fund, but it's about a year, 6 months of benefits, so mostly pay-as-you-go. But as I go down the list, you're going to get countries like Denmark, where the state and occupational benefits are pretty much entirely pre-funded. And you can go to another extreme like Singapore, where not only pension, but also retiree healthcare benefits are entirely pre-funded. So there's a lot of variation across countries. Okay. Now, we know, and we've talked about it yesterday, the PAYGO countries are struggling, right? They're struggling because, well, the aging population, that means higher longevity, so more expenses to cover. Retiree healthcare costs are going up. If they're unfunded, well, that means a high liability. Eurostat did research in Europe to estimate the size of the liability, and it's large. If you look on average in Europe, the liability is about 300% of GDP. It's huge. In comparison, you look at formal debt, it's about 76% of GDP, right? So these unfunded pension and healthcare liabilities are about 3 to 4 times the size of regular formal debt. And it varies quite a bit. You take Spain. Spain is very much of a high end on the pay-as-you-go country. It's about 500% of GDP. The unfunded liability. By contrast, if you were to look, let's say, Denmark, again, Denmark is on the funded side, well, it's only 24% of GDP. So massive differences across countries between the pay-as-you-go versus the pre-funded countries. Now, what's fascinating, and linking in a way to Anya's work, what's fascinating is those liabilities of the PAYGO countries are actually quite opaque. We don't know how big they are. I just gave you some research from Eurostat, but it's one estimate. We don't have any official estimates of these liabilities. Even in the US, we don't report the gross liability that is unfunded on Social Security and Medicare. And so that raises 2 questions, and that's what I want to discuss this morning. The first one is, does the limited visibility into the value of these unfunded liabilities encourage governments to rely on PAYGO? 1. 2, once the liabilities become transparent, what are the factors that are driving some governments to transition to funded systems and others to persist with PAYGO? And for that, what we'll do is we're going to focus on OPEBs in the US. Now, if you don't know about OPEBs, they stand for Other Post-Employment Benefits. Right? It's mostly retiree healthcare insurance, above and beyond Medicare. The aggregate unfunded liability for OPEB is large. It's not as large as the unfunded pension liability, but it's not that far behind. It's about $1 trillion in the US. Between 1 and 2 trillion, depending on the discount rates that you choose. What we've shown, good news, we actually just got the publication this morning was just announced. What we find is that states with higher unfunded OPEB liabilities have higher bond yields. So actually that risk is priced by investors. Okay? Now what's interesting about OPEBs is this. In 2006-2007, GASB had some guidelines, 43 and 45, and those guidelines encouraged the states as well as the local governments to fund these liabilities. To report the value of these liabilities. It was not mandatory, but the credit agencies took over, and essentially pretty much everyone reports them now. What's really interesting is before the reform, all the governments were paying OPEBs on a PAYGO basis. Since the reform, you start to see some governments that are establishing funding mechanisms. Okay, so what we'll do is 3 things in the paper. The first is we're going to collect data on OPEBs and study the post-reform funding dynamics. So we'll look at 2009 to 2023. The second is we'll develop a conceptual framework to explain the heterogeneity in the funding dynamics. And then we're going to do a couple of case studies of states that are taking very different path following the reform. Okay? So to give you a sense of what the findings look like, what's really interesting is there's a divergence in funding strategies. You have about 10 states as of today that continue to rely on PAYGO to finance OPEBs, but then you get 36 states that increase the funding ratio by about 30 percentage points. Some states went all the way to 70 percentage points, like Utah, Ohio, Arizona. Those states with high health cost pressures were the ones that increased funding the most. When we start to try to make sense of where this is coming from, what we find is the funding decision really is the result of an interplay between an operating leverage and a financial leverage decisions. Two decisions that are made jointly under constraints, like the size of the liability, the legal flexibility, the fiscal capacity, but these constraints vary across states. And so once you take that into account, you start to understand why there's such heterogeneity in funding dynamics. Okay, so I'll start by giving you some nice map. This is in 2009. You can see the geography of funding ratios. Light means PAYGO. This is light orange is between up to 20%. Orange is 20 to 50. Arizona here is above 50. You can tell for the most part in 2009, it's mostly unfunded. Okay, this is 2023. Went up by on average 24 percentage points, but it went up very unevenly, right? So you still have a bunch of PAYGO states. Keep in mind we're aggregating the plans at the state level. So this is all PAYGO. And then you start to see some funding, and there's about 12 states or so now that have funding ratios about 50%, so very uneven growth in the funding ratios. Here we compare the OPEBs to the pensions. So every year, you can look at the distribution of funding ratios. OPEBs are in red, pensions are in blue. Okay, so you can track that every year. You find that pensions tend to be better funded than OPEBs. Okay? But what's really interesting is what used to be more of a zero funding, you can see, again, a divergence where some of them remain zero and some of the others actually fund quite high. So again, a big divergence, even compared to what we've seen on the pensions, where the variability within the pension side is actually fairly stable over time. Now, the question is, well, which states are the ones going on the funding side? So we can do some regressions here. We can look at, who increases funding the most? You can regress that on, was there some funding back in 2009? What was the size of the OPEB liability to income ratio in 2009? How much rise in healthcare expenditures the states were facing in 2009? What was the OPEB funding, the pension funding ratio in 2009? I'm not going to bore you through all the results, but there's two things that really stand out. The first one is those states with some funding back in 2009, they're the ones that funded the most afterwards. So again, there's persistence in the funding path. Either you stay PAYGO or you start funding and you continue going up your way. The other point that is really interesting is those states with high healthcare costs or a really big rise in healthcare costs, they were the ones that actually started to fund the most. Okay? So how do we make sense of these results? Let's take a step back. If we think about the OPEB contract, what is it? Well, like pensions, it's a deferred compensation. So every time I work, and by the way, everything that I've done is for public sector workers. Here, every time we work, we accrue OPEBs. Okay? And it gives us indefinite retiree healthcare coverage throughout retirement. But unlike pensions, the OPEB contract exposes governments to healthcare cost risk. It's a commitment to pay the OPEBs. We don't know how much that healthcare cost will be in 20, 30 years from now. The governments are on the hook. Now, at any point in time, governments have to make two decisions. The first thing they need to do is to define the scope, the design of the promise. For example, how generous it has to be, the payment type, the eligibility criteria. They have to define that commitment. Okay? So that's very much of an operating leverage decision. And then they have to decide how to finance that commitment. You can use existing tax revenue. You can borrow money to pre-fund OPEBs, or you can just do PAYGO. So the operating leverage and the financing leverage, actually, in theory, if there's no frictions, in theory, they should be independent of one another. You could offer OPEBs. You can use tax revenue, and you can issue debt and pre-fund them. That's one way. You can offer the same OPEBs, and you can do a PAYGO basis where you pay them when they're due. So in theory, the financing and the operating leverage are not related to each other. But of course, in the world with frictions, well, they become intertwined. And if we go back, especially the pre-GASB environment, the PAYGO promises were opaque. So that's an information friction. And so at that point, back then, the OPEB liability was small. It was cheap to offer OPEBs as opposed to raising wages. So unions were negotiating to get OPEB benefits as opposed to a wage increase. And it was cheap to finance OPEBs via PAYGO because at that point, the risk was not fully priced in. Investors were not realizing the cost of that liability. So actually, if anything, what this encouraged states to do was to expand their operating and financial leverage and build up these unfunded liabilities. Okay. Now, when we think about what are the factors that are driving these decisions, in my view, there's three factors. The first one is, well, you wake up in the morning, you're the policymaker. What's the size and how visible is that OPEB promise? And how exposed it is to rising healthcare costs? That's your state variable, so to speak. The second is, what are your operating leverage factors? Can you renegotiate these OPEBs? Well, it's going to depend, right? It depends on how constitutionally protected they are. How strong are the collective bargaining agreements? Good luck with that if they're strong. How competitive the labor market is, right? You may want to continue offering them because you have to recruit public sector employees. There's reputation costs that are coming in if you have to cut down on the OPEBs, plus you may have other priorities as well that you need to finance. And then you have your financial leverage factors, right? How visible is that liability? Is it priced in or not, the risk? Are there debt limits on formal borrowing? Do you have any fiscal stress that prevents you from pre-funding? What's the credibility of the funding commitment? Do you have other commitments? And then do you have the institutional expertise to finance the OPEBs? Because you have to create a trust. You have to manage that trust. For a small municipality, it may not be trivial to do so. So now if we think about the before versus after GASB, before the GASB rules, we had opaque OPEBs, we had a low liability, at least lower than now, we had lower healthcare costs. So as I was saying before, this is, if anything, encouraging the states and the governments to use the OPEB, the PAYGO approach, so they're expanding their operational and financial leverage, and so they've accumulated large and unfunded liabilities. Afterwards, if anything, the OPEBs became a lot more transparent, and on top of that, you wake up in the morning and the liability is huge, exposure to health cost is large. So what we see is that this is encouraging the states to cut the OPEBs and to start the pre-funding. And if you're going to take debt, take it through the formal channel, but less so through the OPEB. There's no more any advantage because it is transparent. But the extent to which you can do so is going to depend on, well, your ability to adjust benefits and your ability to mobilize resources. So we can create a bit of a quadrant, if you think, where you can put states, depending on how much they can finance OPEBs and how much they can adjust benefits. If they can do both, well, what we should expect to see is they're going to cut the benefits and start the pre-funding. If they can't cut the benefits, but they have the ability to pre-fund, we should see that they'll keep the benefits, they'll start the pre-funding. If they cannot do anything, well, they'll keep the benefits, they'll continue PAYGO as of today. And if they can, no benefits, no ability to finance OPEBs, but they have the ability to cut benefits, they'll cut the benefits, but they'll stay to PAYGO. Okay? And we see evidence of that in the different states. So I'll start with Hawaii. Hawaii is a state where the OPEB was huge. It was about $16 billion, was about $11,000 per capita. When I mean per capita, it's not just per public sector worker, per everyone in the province. The OPEB liabilities are protected by the state constitution, like the pension, so not easy to cut. In 2013, Hawaii enacted a legislation, actually quite a landmark legislation, that initiated a switch from PAYGO to pre-funding. This came at a time of fiscal strength. But if you think about the annual contributions, the rise was huge. I mean, it went all the way from about $268 million per year all the way to over $1 billion per year about 10 years later. But they did it. Now, why did they do it? Well, three factors made the switch easier. The first is the whole thing was codified into law, so there was a credible funding initiative there that was done. The second is when you look at the way they did it, there was a 5-year phase-in period, so to make it easier on the municipalities, they increased gradually the contributions. And the third is it turns out in Hawaii in 2001, they had consolidated all the OPEBs into one trust. So the one trust had the expertise to be able to manage the pre-funding. That made it a lot easier to manage. So that's Hawaii. Now, I'm going to switch to New York. New York is low ability to finance the benefits and low ability to mobilize resources. So if anything, New York has remained on PAYGO. They still have, actually, some of the most generous OPEB benefits in the country. It's all PAYGO. As of 2008, the liability for the state was $50 billion. Just for the city alone was about $58 billion. There's 4 barriers that are preventing New York from transitioning from PAYGO to a pre-funded model. The first is, well, actually, the state lacks clear statutory authority to create irrevocable trust. So that makes it really hard to fund, because all you're doing is you're giving cash to the next politician in charge to be able to draw down the fund, whatever they need to. So there is a trust, but actually it's been used as a rainy day fund, so very little money accumulated. The second is actually very fragmented, so it's really hard to coordinate. Unlike Hawaii, this is, I'm sure you've been there in Manhattan, right? The Hugh Battery Park, it's beautiful there. You have the city authority there. They have 180 employees. They participate in the joint pension plan. So centralized, but they have their own OPEB plan. Right? So really hard to coordinate when you have tiny employers like this and to get the funding right. The third piece about New York is that the strong collective union bargaining agreements make it really hard to adjust benefits, and actually, so a lot of lawsuits actually on trying to adjust the OPEB benefits. The fourth is fiscal stress and the large liability. So they cannot afford to switch to pre-funding. They're well aware of it. You look at the controller's office, they've done the math. They can see how much it costs, but they can't do it because it's too much. And so they remain on PAYGO. The final piece, and I'll have to stop here, is on Wisconsin. Wisconsin's really interesting. Wisconsin has a bit of a dual structure. Some of the trust funds are managed centrally, but most of them are city plans and they remain pay-as-you-go. Like New York, for a while, the collective bargaining agreements were really strong, and so it was really hard to change. But if you remember, in 2011, the governor, Scott Walker, enacted the budget repair bill that essentially just cut through all the collective bargaining agreements. That was a tough fight. There was a big push back. The Democrats left. They couldn't get quorum. They passed it through. There was a recall election, but they made it. Ultimately, they passed it. But ever since what we saw, the cities had the ability to cut the benefits they did. Most of them stayed on PAYGO because of the fiscal constraints, but a few of them, the wealthier ones, actually switched to a pre-funded system, like Walworth County, and actually 6 years later became fully funded. So that's why we see Wisconsin in the upper side of the quadrant, depending on where you are. So I'll stop here because I'm running out of time. 4 takeaways. The first is, well, today, actually, most PAYGO environments around the world are pre-GASB environments. We don't know what the liability are. So that actually makes us think, do we have an excess amount of liabilities through this PAYGO mechanism? The decision to transition really differs across states. It depends very much on the ability to adjust benefits and the ability to mobilize resources. I'll give you one number to finish, which I find quite striking. When you look at the difference between PAYGO and funded systems over the long run, it's huge. You look at New York, there had to be we talked about New York City, about a $58 billion liability back in 2006. Today, it's $100 billion. So multiplied by 2. Hawaii in 2012 was going the exact same path, went from a PAYGO system in 2012 to a pre-funded system today, and they halved their liability from about 12 to 6 billion. Right? So you can really see after 20 years the divergence and the outcome of these systems. I'll stop here and look forward to Sean's comments.